Welcome back. I'm Willow Bay. Pregnant women have a lot to consider when preparing for their baby's grand entrance. Everything from setting up the nursery to choosing a pediatrician. But registered nurse and author Barb Dehn says many women are still underinformed about the process of giving birth. She's here to separate fact from fiction about what happens during the childbirthing process. Barbara, thanks for joining us.
Hi, Willow.
So why is it that women are a little bit naive, a little bit underinformed about giving birth, particularly when we are now obsessed with every detail of our pregnancies and every detail of setting up the nursery, et cetera, et cetera?
I think it's still overwhelming, and it's one of the most vulnerable times in a woman's life, so she can never get enough information.
You have put together a bunch of myths for us, epidurals being one of them. Let's talk about this particular notion with an epidural that you should wait until the very last second. Because it slows down the labor process, or what is that about?
You know, some people did think that. They thought that if you got it too early that it would stop your labor, then you'd end up with a C-section. What we know now, it's kind of like Goldilocks. You know, it can't be too early, it can't be too late, it has to be just right. So if you're already in the process of labor and your contractions are well established, it helps decrease all those stress hormones, and then it helps a woman relax and actually give birth a little bit faster.
So is any time in this process a good time to say, I'll take it now, please?
I think as soon as it's offered, if they say it's safe for you to have it, go ahead and have it. Don't wait until you can't stand another minute.
Because there's just no reason for it.
There's no reason for it, because it really does help you manage your pain.
Breastfeeding. We think, okay, the baby comes, then I'll figure out, I'll learn how to breastfeed. You say that's not the way to go.
Really, it's better to take classes beforehand. I mean, after all, it's a new skill for mom, it's a new skill for baby, and if you take classes beforehand, you get to know all of the ins and outs and what works and what doesn't.
But I think a lot of women think, why do I have to take a class in breastfeeding? It's, you know, it's supposed to come naturally. Well, how am I going to get help from a class?
Exactly, but a lot of times what we do is we work on positioning, and positioning is key. And so one of the things that works is to use a pillow. Now I brought this Go pillow, and this was designed by a mom, and it helps you put the baby where it's supposed to go. And if you're uncomfortable about breastfeeding in public, you can just put this over your shoulder for some discretion.
And cover up all in one.
So I love this because it's all about positioning, and if the baby's positioned well, breastfeeding shouldn't hurt.
Okay, the next thing we're going to talk about is cord blood collection. So there's a myth that, you know, if I'm not at risk for any, you know, genetic diseases, I really don't need to bother with storing the cord blood. You say that's not, in fact, correct. That's old, outdated information.
You're right. It is old, outdated information. What we used to know is very different than what we know today. There are studies going on right now that are exploring the use of using a baby's own cord blood stem cells to treat things like diabetes, heart disease, brain injury, and even cerebral palsy.
So what do you need to do? Because I mean, when I had my second child, this was still relatively new and it seemed a little wacky. What do you need to do? Do you need to let your doctor know in advance? Do you need to let the hospital know in advance now in order to be prepared to have your cord blood collected?
Right. I'm so glad you asked, because all you need to do is go to cordblood.com. You can call cordblood.com and you can arrange to have it taken care of. Your doctor may have some kits in their office for you, but it's a very, very important thing to consider in light of all of the new discoveries for what these stem cells in cord blood can do.
And new discoveries that are rolling in practically every day.
Every single day we're finding out something new about what they can do. The other thing I like about cord blood banking is that you can have a designated transplant program. In other words, if there's a family member who has someone with sickle cell anemia or certain leukemias, it can be banked free of charge, regardless of the financial situation of the family. And I've even signed up some of my patients.
Wow. Another myth about episiotomies, that you just never need them. It's an old-fashioned thing that no women really needs during birth.
We never like to do it unless it's necessary, but sometimes a baby's born and they're in distress, and so if we can make the opening a little wider, we can get that baby out a lot faster. And if that happens, ice packs are the way to go. So ice, ice, and more ice.
And that decision is made between you and your doctor?
Really,
Should you have a conversation with your doctor about it beforehand?
I think so. I think you want to talk about it. What are the circumstances in which you would do an episiotomy? And then ask them, what is their policy? Most OBGYNs now are really listening to their patients and saying, what is it that you'd like to have happen?
Okay, if my water breaks, I need to deliver in 24 hours.
That's another old myth. So you can wait 72 hours as long as there's no fever or temperature.
So 72 hours, that's quite...
That's
quite a while.
3 days. God forbid it should take that long to have a
Exactly.
baby.
Well, speaking of which, another myth that labor means constant pain.
Well, it doesn't. You'll have pain once in a while, and you'll have a little bit of a break in between.
And use those breaks wisely.
Yeah, use those breaks to get some ice chips or some popsicles or to talk to your partner.
All right, something we didn't talk about, but I know that you have some strong opinions about, are prenatal vitamins.
You know, a lot of women feel like after they have their baby, they can stop taking their prenatal vitamin. But that's the time when you need those nutrients and those vitamins. And I like this new one a day. It's a women's prenatal. And you know what? You don't need a prescription for it. You can get it over the counter. And it has both DHA, which is an omega-3 fatty acid, and folic acid. And so this is great for mom as she's recovering. It's also great if you're breastfeeding, because then you're giving those essential nutrients to the baby. So this is a very good brand.
So don't toss away your prenatals, just use them, take them until the bottle's done.
Right, it's hard to remember, especially if you're sleep deprived, but it's great to keep taking your vitamin 1 a day.
Barbara Dehn, thank you very much for
Laura.
sharing
It was
your
a
insights
pleasure.
with us. And if you want some more tips on the birthing process, you can visit Barbara's website at blueorchidpress.com. Thanks for watching GMA Now.